Good afternoon, everyone. Michelle Casada here with WPTV. Thank you for joining us this afternoon, probably during your lunch hour. We are talking about the increase of COVID cases that the entire state of Florida is seeing right now. We have Dr. Charles Murphy. He's the Chief Quality Officer at Jupiter Medical Center. Dr. Murphy, thank you so much for joining us for this discussion.
My pleasure.
And, I want to start off with just talking about the level of transmission of COVID-19 that we're seeing in the state right now. If you go onto the CDC's website, they have a really nice map of the entire United States, and you see the entire state of Florida in the red at the high level of transmission. Is that equivalent to what you're seeing right now, Dr. Murphy, at the hospital?
Yes, it is. We've seen a significant increase in cases. Several weeks ago, we'd actually dropped to between 0 to 5 cases in the hospital, and we've currently increased to above 30 cases currently at the hospital at Jupiter. So we've certainly seen that significant increase, and that mirrors the increases that are being seen both in the state of Florida as well as in Palm Beach County. Concerning signs are the percent positivity rate in the state is 11.5%, so it's well above the 5% level that we'd like to see. The retransmission rate is significantly above 1 now, which indicates that the pandemic is increasing in size, and certainly the number of new cases has increased across the state. As you indicate, Florida is unfortunately one of the highest levels in the country currently.
And when you say that you're up to seeing 30 cases, you're talking about daily coming into the hospital?
No, this is a total census in the hospital. So generally, it's probably 5 new cases being admitted per day. And then the overall census is above 30 patients.
When you look at the cases from those who are being hospitalized, what kind of symptoms are they seeing? Is this pretty severe illness that they're coming into the hospital? Do you ask them if they did receive the vaccine versus if they're unvaccinated?
Yes, well, essentially this has become a pandemic of the unvaccinated. So the vast majority of the cases that we're seeing that are requiring hospitalization are individuals who are not vaccinated. We are seeing younger patients compared to the prior surges in the pandemic. So we're seeing patients in their 30s, 40s, and 50s that are requiring hospitalization. I will say of the 30 patients that are in the hospital, only a few patients are requiring the intensive care unit level of stay. So in some sense, a bit less severe disease than we had seen in the initial surges with the pandemic, where our critical care units and the ventilators were frequently in use.
So we are seeing a better chance at survival, since we're seeing a younger group of people, even though they are unvaccinated, going into the hospital, being able to go through treatment for COVID-19.
Yes, but I would emphasize that I think at the state level, there are 50 to 60 patients dying per day related to COVID. So this certainly still has the potential to be a fatal disease. And then we also more and more recognition of the long-term sequelae of having COVID infections. So long-term brain neurologic impacts on the lungs and also on the heart.
I want to just really quick address, our viewers who are joining in and commenting. Please go ahead and ask your questions. We will be taking those questions for Dr. Murphy to answer as well as he can. Dr. Murphy, real quick, I wanted to go back to July 17, 2020, when our state positivity rate was 11.3%, and now we're at 11.5%. And at that point last year, we were seeing somewhat of a downward trend between June and August statewide, versus now we're seeing an uphill climb here. Is there some concern that we are going backwards? Is it the variant? Is it that there are people unvaccinated? I mean, are you seeing anybody entering the hospitals who are vaccinated and are still getting COVID-19?
There are some breakthrough cases of individuals that are vaccinated that have developed COVID infections. I believe the last number I saw nationally was 6,000. I'm certain that it's higher than that currently. Most individuals who are vaccinated who do become infected, it's either they have no symptoms or they have mild symptoms. In our case, the few patients that we've seen that have been fully vaccinated and then develop infection, it's in patients that are immunocompromised. Their immune systems don't work normally. So again, that's relatively unusual. By far, the vast majority of the cases that we're seeing are not vaccinated. And again, one of my messages would be to encourage people to reconsider vaccination if you're not vaccinated. The vaccines are very effective at preventing severe disease, hospitalization, death related to COVID. It's the best way to protect yourself and your loved ones, and they're very safe. As with anything, there is some small risk related to being vaccinated, but the risk of the vaccine is very low. The benefit is very high.
I want to bring back that question Dawn had. Speaking about the vaccinated, when they get COVID, being vaccinated, are they contagious? She's asking. Is that a situation that you're seeing?
That's a great question. To the best of our knowledge, I would say that patients who have been vaccinated are almost certainly less contagious than someone who's infected that's not vaccinated. I think that is an issue that's currently under investigation. When you think about the amount of time that we've had vaccines available, I mean, we're still in a learning phase. And so I think there has to be some patience to realize that it takes time to develop the information and the knowledge with some of these things. But that's an important question, but one I think that we're still learning about.
And Robin is asking, what are the symptoms of the Delta variant? Is there any difference that you'll be feeling versus, getting COVID or knowing if it's a variant or not?
We've seen some more gastrointestinal complaints with the Delta variant infections, but again, the symptoms are similar to COVID in general: fever, cough, shortness of breath. Certainly shortness of breath is one of the concerning symptoms, and would certainly should trigger people to be evaluated. So I think those are some of the main ones. Still, the loss of smell and taste are important symptoms that should trigger one to be concerned that they might have a COVID infection.
When it comes to those who are, and I know it's a very small number, 6,000 nationally, those vaccine infection breakthroughs, is it suspected that these could be variants that are breaking through, those vaccinated patients? Is there any way to tell the difference, versus sending the test to a state lab or to the CDC? Like, are medical professionals like yourself able to tell the difference?
Well, something like 68% of the cases currently are the Delta variant. It's increased dramatically. It basically has been doubling every couple of weeks. So as you're sort of suggesting, we don't know for sure unless it's tested at a state lab or at a federal lab. But certainly, there's a good chance that these breakthrough infections do represent the Delta variant. We do have some evidence that the vaccines are slightly less protective against the Delta variant, but we also do know that the vaccines are still very protective against severe hospitalizations or death.
And Tuvia Bielski is asking, if it's so safe, the vaccine, why has the FDA not approved it yet? What information can you provide, doctor?
Most of us believe that the FDA will be approving all three vaccines. These vaccines have been given to a very large number of individuals, even in the United States. I think it's 140 or 150 million people. And again, the safety profile is very good. I think that they have been doing a fast track process. They moved very quickly with the emergency use authorizations. I think that getting the full approval, which I do expect will occur, would be helpful, I think, in terms of encouraging some people that are not certain to consider the decision. And it also, I think, would help when companies are making decisions about whether to require vaccinations for their employees and such. So that's a great question. I believe that it's almost certain that the approval will come, the full approval, and it's just a matter of time.
Doctor, while we look at, the national push to try to get those unvaccinated vaccinated, can you talk a little bit about the importance of being vaccinated and how that helps stop the spread and possible involvement of mutations of this virus? Why is this so important?
Well, again, the best protection we have against the virus is vaccination. I think, one, from a personal perspective, protecting yourself, I think that the best way you can protect yourself is by vaccination. I think all of us have acquaintances, families, friends, loved ones, and that's also the best way to protect them. And then on a larger societal standpoint, the higher percentage that we have vaccinated, you do get essentially a herd immunity, and you do get into a situation where the numbers of infections will fall precipitously because the virus has no place to go. So, we did actually see that happening earlier this year until the new variants came out. So, again, I think that there's multiple reasons why people should want to be vaccinated. And again, the objective data is that these vaccines are very, very, very safe and have very few side effects. And again, it's just not dying from COVID. As I was talking about, there are long-term sequelae, long-term health impacts of having a COVID infection. Even for the younger patients or younger people are unlikely to get severe disease or death, there still are important health impacts related to having COVID infection.
And doctor, you may or may not be able to answer this question, but your medical opinion. Rachel has a good question. Why is there not better advice out there after getting a positive result? She says there's no direction to seek primary medical care at all to prevent getting to the point of needing to be seen by the ER doctors. She says doctors don't even know their patients had a positive result. So I'm assuming she's also talking about some of the monoclonal antibodies and treatments out there for those who do get COVID and are sick, that they may be able to do this without progressing to the point of needing to go to the ER. Why isn't there more information out there about this?
Well, I think that certainly there's been an attempt to get information out. I think one of the challenges is that the information has been changing over time, and the recommendations have been changing over time because the situation has changed and we develop new information. And I think that that's confusing to people when you do have, because the answers aren't set in stone. I think that if you're tested for COVID, it's important to follow up and find out that result, and to not count on anyone else to necessarily automatically provide that follow-up. So, if I had a COVID test, I would be following up to make certain that I knew what that result was. I think that if you are asymptomatic, if you have no symptoms, if you have very mild symptoms, I think touching base with a healthcare provider makes sense. I think that certainly if you're having any thing in a way that you normally would think of needing to go to an emergency room, such as shortness of breath, chest pain, any very high fever, any types of symptoms on that level. I think that, again, I would recommend that people use, in a sense, common sense to that, and again, err on the side of getting things checked versus not getting things checked. And I do think that there are very reliable sources of information, medical sources of information that people can go to. I think that the CDC has information available, respected hospital systems such as Johns Hopkins, Mayo Clinic, and others that have websites. Those are places that people can go for additional information. So I think gaining knowledge as a person in facing this pandemic, I think that getting more knowledge is better.
And absolutely, you agree with, if someone does come back with a positive test, whether their symptoms are mild or moderate, that they should be at least letting their healthcare provider know with the situation to get the best medical advice.
Absolutely.
Another question that, I had in mind too is, what are you seeing now in the hospital setting? I know, a few months ago, things were kind of calming down, and now we're seeing COVID units open back up. Jim Crowning had a question: how full is your COVID section at the hospital?
Well, as I said, we have over 30 patients in the hospital now. I think it's important to let people know we do have hospital beds available. We have ventilator beds. We have ventilators available. We have intensive care beds available. We have a trained staff that they've done an amazing job through this pandemic, and they're experienced now in taking care of COVID patients. And so I think one current difference at this time is that the systems are not as stressed as that they were early on in the pandemic. So there is capacity to handle the patients that we're seeing. And I think the other thing I would say is that we certainly have the capacity as well and the capabilities to take care of the patients that need to be hospitalized for other reasons. And we do have a COVID unit, so those patients are being cohorted. So if for some reason you need healthcare related to a non-COVID reason, that the hospitals in the area are very capable of providing that care as well. So we don't want anybody to avoid going to a hospital for other reasons as well.
And SK has a question on what early treatments for COVID are offered at JMC.
Right. That's a great question. We've actually been one of the few hospitals that has offered monoclonal antibody therapy really for months to patients who are outpatients with COVID, who are COVID positive, who are at high risk of developing severe disease. And we're actually very proud that we did that. This is one area where things have changed, and part of that is because of the variants. So some of the original monoclonal antibody therapies are no longer as effective, and they're not recommended for use currently. But there are other alternatives which are currently useful, and we are working with the state to provide access to those therapies early on in the disease to try to prevent people from then having progression of the disease to where they have severe disease and are requiring hospitalization. So that's a great question, and it is something that we're certainly actively working on.
Doctor, this might be controversial for a lot of people, but what is your position on mask wearing now, even for those who are vaccinated, seeing as how we're seeing the cases go up and we're seeing variants that are very contagious in our area?
Right. Well, first I'd like to say that at the hospital, we're following the CDC guidelines, which are that everyone should wear masks when they're at the hospital. So our physicians, our staff, our visitors, we're really mandating that everyone still wear masks in this setting. I think people need to understand that some of our patients are immunocompromised, their immune systems don't work properly. We're trying to do everything we can to protect our staff. We don't know someone's vaccination status. So for all these reasons, and out of an abundance of caution, we still are having everyone mask in the healthcare setting. And I anticipate that will be the case for a while. I do think that people should stay abreast of the current CDC recommendations related to this. I would say from a personal perspective, and this is a personal perspective, I think that if you are in a area where there is a lot of COVID disease, that it would still make sense to wear masks, social distance, and use hand hygiene, because or that whether someone has a variant or not. And I think that again, it makes sense from a public health perspective to be using an abundance of caution and really trying to, we're seeing an exponential increase in cases. So I do think that it makes sense in these areas with large number of cases to do those things.
And we're also getting a lot of questions about children. And I missed, I can't find it now, but there have been questions about, given that children under 12 don't have access to the vaccine yet, is this a concern for when school starts up again? Should there be a mask? Should parents be sending their kids to school without a mask, even though we're still waiting to see how that's decided in the school system? What are your thoughts on children? Do you see children getting sick and having issues with the variant as well?
Children can become ill with COVID. Fortunately, many children do not have the more severe disease. But again, there's a small subset of children that have developed very severe disease and even died related to that. The area involving children in COVID is, again, and vaccinations is under there are a lot of trials, a lot of investigation ongoing. Of course, as a health provider, we want to absolutely make very careful decisions when it comes to children, particularly in the setting where the statistics are that they are less likely to have severe disease. I think every parent does need to educate themselves and follow these discussions about vaccinations. There's a National Advisory Committee on Immunization Practices, which advises the CDC. Obviously, the CDC and the FDA are very involved in this. I know the people there take this responsibility very seriously and are trying to develop the best, safest recommendations given the current level of knowledge. And this knowledge is changing frequently. And so I think that all of us are concerned about the situation regarding schools. And it's a complex issue. And I think that, again, as a parent, people are going to have legitimate disagreements and such, and I think we should be very respectful of that. But at the end of the day, we want to keep our children safe.
Absolutely. And, are you seeing that in the hospital setting? I know you said you've seen more COVID cases. Have you seen more children coming in, or is that pretty low number?
Yeah, we have seen some children. That number at our facility has been low.
Okay. And, someone asked too, and there have been a couple questions about where has the flu been? Have you seen cases of the flu at all? Because I know that people are concerned about everything's about COVID, but what about the flu?
That's a really great question. the numbers for flu cases were very low this year, and that started in Australia, which usually leads us. And again, this seems to be related to the masking, social distancing, and hand hygiene that was done for COVID. But I think that we did see far less flu illness that was related to some of these public health measures that were put in place. And I know that for this upcoming year, again, one of the things that's being worked on is flu vaccination and COVID vaccination. We certainly encourage people to receive flu vaccines at the appropriate times, and when they're in the appropriate groups, we encourage the use of flu vaccines as well. So this, again, is an area that is under a lot of current study.
Doctor, you mentioned this, you tapped into this a little bit earlier, the long-term effects of COVID. Are you seeing that there are any other more severe long-term effects from these variants that we're seeing in our area as well, the Delta being one of the most common ones?
Well, remember the uptrend in the Delta cases is really fairly recent. I think that most of our experience with long COVID or the long-term impacts of COVID are with some of the earlier variants, and there's no question that there are long-term health impacts for individuals that have been infected with COVID. I think that as a society's healthcare system, we're going to see these really significant impacts going forward.
And there were questions too about whether you've seen side effects from the vaccines. On the contrary of, getting sick with COVID, have you seen side effects from the vaccines that might be long-term?
Sorry, I'm pausing because I really want to take my time and think.
And please, for those viewers who are asking questions, I'm trying to get to as many as possible.
Sure. I have not personally seen them. I think that the two areas in terms of vaccines, with some of the vaccines, there was the increased presence of blood clots developing.
We saw that.
Again, it was fairly rare, but in women, there was an increased incidence of blood clotting. And then there was also, with one of the other vaccines, there was some what's called myocarditis, pericarditis inflammation in younger males, which was seen. But again, these side effects or adverse effects were seen in very, very small numbers of patients when you consider the hundreds of millions of patients that have received the vaccines. And again, in my world, we make decisions based on a risk-benefit analysis. You look at the risk, you look at the benefits, and then you make decisions based on that. And the benefits of the vaccines far, far, far outweigh the risk. It's obviously is very tragic and sad when someone does have a significant adverse effect from a vaccine, but there's no question that it was the right decision to have that vaccine.
Anna has a question about kids with food allergies. Is that something to worry about or be concerned about if they got the COVID vaccine? Are allergies an area of concern?
There is. I think that in general, if someone has had allergies to vaccines, that is they really need to seek the input from their healthcare provider. And I would say the same if they're food allergies. I would encourage them to certainly talk to their child's healthcare provider before making a decision.
There is a really good question on here from Karina. What are the reinfection numbers of COVID-19? And I'm curious to know myself, are you seeing people who had COVID come back reinfected with possibly a variant? Is that something that's common or rare?
I don't think it's been common. I'd say it's relatively uncommon thus far. It's a great question. And certainly we do know that immunity will fall off over time, and antibodies will fall off over time. So one of the things that people should look at is the levels of antibodies. So we know those decrease over time. So it is possible to develop a COVID infection again, but the immune system is very complicated and it's actually well designed. So there are also these B cells and T cells that then and memory cells that offer a longer term protection, particularly against the severe illness that we're trying to prevent. And so it's still unknown how long vaccination will provide protection. I'm sure that people have seen there's a lot of discussion about, whether or not a booster shot will be required. One of the Pfizer has requested an EUA, an emergency use authorization, for boosters of their vaccines based on some of their data and some data out of Israel. However, the CDC and the FDA did a joint statement that stated that they do not believe that booster shots are indicated at the current time based on all of the evidence that's available. So I think, again, this is an area that is under active investigation where time is, we're gaining additional information as time goes on, and it's certainly something that people should pay attention to.
No, this is a good question too, and we probably should have got to it at the top of our discussion. What is a chief quality officer? People want to know what your role is at Jupiter Medical Center.
Well, I appreciate that question. So, in healthcare, we want to do no preventable harm. We don't want to harm patients, and we don't want to have our staff harmed. What we're trying to do is become very highly reliable. So have the correct systems and processes in place so that the patients are receiving very high level care that's based on evidence, and they're receiving that every single time. And so it's really putting those processes into place to enable that to occur. And, you don't want to rely on humans entirely who make mistakes, who are fallible. You want to have systems and processes in place to deliver that outstanding care every time. And, we're very fortunate in this area. There are many high quality hospitals. We're very, very proud of our multiple awards for safety and quality at Jupiter, but are always striving to be better.
So more like looking at data and the systems in the hospital and bringing that all together to find the best areas for practice. Am I summarizing correctly?
Yes, that's
Okay.
a great summary.
Great. Thank you so much. And, doctor, I'm curious to know, what is the reaction or sentiment you get from those patients, or what is the staff hearing from those patients who are coming into the hospital with COVID and are unvaccinated? When they're asked, did you get the vaccine? No, I didn't. Well, you have COVID. Are you hearing from them saying, I should have gotten the vaccine, or, I feel terrible, would the vaccine have been a better option? I'm just curious to see what the sentiment or what the reaction is out of those patients.
Yeah, I think there's a variety of reactions, and we've certainly seen those. I mean, obviously, if then someone does get COVID and require hospitalization, it's a natural thing to second guess and say, "Geez, I wish I'd gotten vaccinated sooner." We are here to take care of patients, and we feel for, these, again, as I've said, that the information has changed. New information becomes available. People are trying to make the best decisions they can under the circumstances. It's definitely been a very complex situation. And again, at the end of the day, we absolutely recommend that people become vaccinated. I certainly believe that if you're not vaccinated, I would encourage you to wear a mask and socially distance and avoid large groups. The same recommendations that we had for people before vaccinations became available. But I do believe our best option at this time is to get vaccinations.
Thank you so much, Doctor. I really appreciate your time, and I appreciate all the viewers. For those we didn't get to your questions, I appreciate you participating. For those that we did, I'm very glad you asked these questions. And again, this is a decision that every person has to make for their own health, for their own family. So I appreciate you, Doctor, giving us the facts and giving us, talking stats with us, and what the numbers, what you're seeing right now in the hospital is actually, what people want to know right now, what's happening. So here we have another comment. Thank you, Doctor, for your time. So I appreciate you, Dr. Murphy. Have a wonderful day. And we're going to have much more coverage on this later on today in our newscast at 5 and 6 on WPTV.
Well, we really thank you for actually doing this and trying to educate the public, because it is a crucial area. And so the role you play is incredibly important, and we appreciate that as well.
Thank you so much. I appreciate that. All right, Doctor, have a great day. Thank you, everyone, for joining in.